Hello, everyone. Welcome to another LAM CAA assessment, this time for diagnosis by palpation. This is all for our certified associate acupuncturist aspirants from the Philippines. Let's get started with the first one. Let's call on Dr. Janine Chan, naturopath. Number
Good
one.
afternoon, Doc. Good afternoon, everyone.
What can palpation tell you?
The information about various areas of the body, the meridians, acupoints, patient's overall condition, and general condition of the meridians and the organs.
So palpation can actually tell us the condition of the various parts, various areas of the body, even the meridians, the acupoints, and the overall condition of the patient, and meridian and organ general condition. Number two, what does palpation include?
Information, again, the same, Doc. Information about the various areas of the body. Meridians, acupoints, overall condition. Parang parehas lang yung sagot sa number one.
Yeah, actually, this is more for the clinical aspect. The first one would be stagnations. And when we diagnose the stagnation, there is always the feeling of distension. So stagnation can be either local or generalized. Then number two is, it would also include identification of the excess or shear or trigger points, okay, which will represent the pain syndrome in the muscle regions. No? Trigger points is what the dry acupuncturists do. No? Ano yung masakit. And third one is channel involvement. As a practitioner, one has to be very good at determining the channel that is involved based on the symptoms of the patient. Number four is it also includes assessment of the organs or ligaments, okay, their health, flexibility, and location. And lastly, we will be determining the adhesions or obstructions. So these are the following very important causes: stagnation, blockages, and dampness. No? Yung iba reklamo na reklamo, pero ang dami namang kinakain na damp. Okay. So that's how vast the area of palpation is. What are the three techniques for palpating?
First, pulse diagnosis. Second, palpation of the skin. And three, pressing and tapping.
Okay. Palpation, pressing, and feeling. But for pulse diagnosis, that would fall under palpation. No? Then pressing, then the feeling. What is palpation of the three techniques?
Involves running one's finger along the course of the 12 channels, often done below knees and elbows, proximally.
Yeah. Below the knees and elbows. Okay. This is something to do with, if you're familiar with the 5 shoe points, no? Knowledge of the 5 transporting points would require you to be very good at the 5 elements. In fact, all channels or all meridians have 5 points each. So as it says here, we ran the fingers along the course of the 12 channels. Well, I have read somewhere that if you already mastered the art of palpation, you can actually already treat patients. Kasi, can you imagine 12 meridians times 5 points per meridian? That's 60 points, no? So yon. And so basically, you don't run your fingers beyond that. So yon. It's often done below the knees and elbows proximally. How many times should the practitioner palpate the channel?
3 times.
Yes, good. And the pressing will be harder as we
go deeper.
Okay.
Yes.
Great. What is pressing? So we're done with palpating. We have Pressing now.
Okay. It involves the use of the thumb or fingers to check for tenderness along certain areas of channel or at particular points.
Okay. This is merely detecting the presence of tenderness. No? If the area is so tender, the patient may not, of course, you may really see changes, right? You may even just observe the facial expression, diba? So that represents that tells us that there's too much of that there's excess. Okay, so pressing is all about checking for tenderness. What does tenderness or pain indicate? Your answer should be either full or empty, or excess or deficient. I think you are muted.
Ay, sorry, full or excess condition, Doc.
Yes, very good. So that's why the probe that we were uh, recommending was actually very useful. No,
Yes, Doc.
what does more pain indicate?
An accumulation of pathogenic evil chi.
Yeah, so this is what they call the Sia chi, no,
CH.
pathogenic factor or the pathogenic chi. In the past, they call this evil chi because they cause diseases. Okay,
Yes.
so the more pain, actually, when you have when there is the presence of evil chi or pathogenic factor, there is more pain. Okay, yon, that's called excess or full. Interesting, di ba? Number 9,
Yes.
what does this tension indicate?
Chi stagnation.
Very good. What does a fixed or stabbing pain indicate?
Blood stasis.
Very good. Or blood stagnation. What does a
Yes.
slippery or hard sensation indicate?
Phlegm.
Yeah. Did you know that phlegm can either be hard or soft? So, what? Of course, it all starts as soft. Um, that's why we have tumors, we have swelling. So there. So if you feel a mass, pray hard that it's still slippery.
Yeah.
Okay? So if it's slippery, that means it's like pearl na nahuhulog sa
Mm-mm.
ano, yun. Okay. So I'm sure after this, you will all go to your patients and feel or you can start with yourself, no? Don't
Yes.
panic. So phlegm, number 12. What is feeling?
Feeling. Discern noticeable changes in temperature, moisture, and skin texture.
Very good. Skin temperature, skin moisture. It's all about, of course, the skin. Temperature, moisture, and texture. What does oily skin indicate? What is the pattern?
Damp phlegm.
Very good. And what is the apical beat?
Refers to the pulse of the heart of the left ventricle, which can be felt in the fifth intercostal channel. Tama ba, Doc?
Intercostal space. Yeah.
Space.
Fifth, there are yeah, count the ribs, including the first one. So as you can see from here, it's 1, 2, 3, 4, 5. So sa baba, intercostal space between the fifth and sixth. Okay. Yon. I'm sure some of you are already feeling your apical beat. Okay. Okay.
Mhm.
What does this mean? The palpation, when you palpate the apical beat, it is clearly felt, not hard, and relatively slow.
It's normal
Good.
palpation. It's normal.
Yeah. Good. Okay. When you palpate the apical beat, it is feeble, without strength. What does this mean?
Deficiency of gathering chi.
Okay. Or the zong qi, right? Lung and heart. Diba? Yeah.
Yes.
So of course, it's efficient, it's feeble, without strength, no? Next. Oh, I'm sure nagpapanik. Now, when you palpate the apical beat at the fifth intercostal space, and then it is strong and hard, what does it mean?
There's an excess condition of the lung and the heart.
So this is where we go through all the patterns already, puro excess. And that's where the first group excels. You know, pattern differentiation. Okay. Just like the pulse, diba? So now, aside from the pulse diagnosis, you will have to feel, of course, you have to ask permission. Can I feel your or do you need to educate the patient? Now, what if the apical beat is large but empty?
There's a heart chi deficiency.
Yeah, and the patient will try to avoid your gaze when you talk to him. Nagwa-wonder yung kanyang case. So, there. And of course, that is not only the way to determine the diagnosis. We should also look at the tongue, diba? Now, this is where your tongue diagnosis comes in so useful, diba?
Maliit ang tongue niya dito, Dok, no?
Yeah, pababa, and then basta there's something different there. Actually, you won't see anything, eh. You wouldn't see anything. It's only chi deficiency. So you would probably be able to tell from the pulse. It's usually medyo mahirap, but it should be a little bit, it's weak, no? Talagang deficient yung pulse. Okay. This one is interesting. Palpation of apical beat reveals the following findings: stopping and then starting. What?
Either severe shock or alcoholism.
Very good. Yeah. So, yes. The patient will not tell you that he or she is alcoholic or severe shock. Okay. Palpation of kasi ganito yon, pag especially when you are witness to a murder, no? You experience severe shock. This will affect the heart. Pero 'di ba, initially it affects the kidney. Ganun lang yon. So the kidney will lose its communication with the heart. Oh, marami-rami na tayo. Thank God.
Pero to, Doc, pag ipapalpate mo siya dun mismo sa intercostal region with the stethoscope na to?
Yeah.
Okay.
But yeah, if you can use the step. Pero mas maganda
kasi alam, akamayin mo lang. Same as the rib. Okay.
Sa step, you'll be able to hear the heartbeat, the breath sounds. But we're going there. We're going there. So master muna natin yung TCM. And I'm sure everyone is affected. Diba? So,
no, kasi we don't usually palpate, di ba, our patients when they come. We only do the pulse, but we don't really palpate them.
Yeah. So this is an add-on. Kasi diba, our palpation doesn't only include pulse diagnosis, it also includes palpation of the body parts, palpation of the areas. Okay, sino ba nauna dumating? Okay, Dr. Mary Angeli, mabuti wala siyang pasyente na ngayon. You will take care of number 26 to 50. Dr. Angeli?
Hello po, Doc. Yes, Doc. Good evening. Mobile pa po, Doc. Pauwi pa sa bahay. Pero sige po. Okay po.
Sige. Ay, nako, baka mamay. Hindi naman kayo nagda-drive siguro. Okay, and then also si Sir Victor will take care of 51 to 75. Sir Victor, yes?
Yes, good evening. Okay po, Doc.
Diba? Ready. I'm sure kung kayo nakukuha ng exam, bawal ang magkamali ng isa. Perfect lahat.
No.
Actually, you cannot just imagine how good I'm feeling right now. Imagine 6 got a perfect score for pattern differentiation. Sana lahat sila. Okay. Anyway. Perfect ha, take note. Challenge yun sa inyo. Gusto ko walang
Tama.
magkakamali ni isa, no? Kukunti lang kayo, iba
Mhm.
absent pa. Okay, so yun. Number 20, palpation of apical beat reveals discrepancy between apical and radial pulse. So itong radial pulse yung ginagawa natin. Remember?
Mm-mm.
So kung hindi
Yes.
siya in sync, what does it mean?
It's a poor prognosis
Yes.
of the
Yeah. But don't give him a very, oh no,
bad report.
but a stare that is like, parang it's doomsday, parang ganun. Okay, so that's not
Oo
how
nga
it
eh.
should be. You should start referring the patient to a cardio. Next, number 21, palpation of apical beat is rapid. What does it mean? Like, what does it signify?
Either a shock, fright, or outbursts of anger.
Good. So yun, alam nyo na ha. Okay. Palpating the, okay, this time, we palpate the chest and we using only light palpation, the patient would dodge. Yung parang, it's painful. No? Of course, if you use the probe, press it up, it's going to hurt. Pero pag kanya imagine, inano ba lang, light palpation,
Finger.
parang yung testing lang the superficial pulse, that's CV17, you know where it is, right? What does it mean?
Heart blood stasis.
Yeah, or heart blood stagnation. So what do you expect the tongue to look like?
Pale.
No, 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 no. Not, oh, no, no, no. Blood
Heart
stain.
blood stasis.
The
Small din, Doc.
color.
Color is pale, di ba, Doc? Pag
No, blood
stasis.
stasis. You were confused between blood stasis
Red.
and blood
Balik.
deficiency.
Oh,
O may
blood.
nag-comment.
O nga pala, blood.
Nag-comment.
Ano pala, heart pala to. Okay, sorry, Doc.
Sige po, exchange sila. Akala ko sagot. Sige po, Sir Vic, exchange daw kayo ni Doktora. Kasi daw baka mawala. Oo, kasi on
Oh,
mobile siya. Okay na, kaya lang yan. Kahit si Sir Vic tumapos lahat, kayang-kaya. Remember, Ma'am Doc Janine, blood
Red siya, Doc.
stagnation. No, it's, ano bang kulay ng blood stagnation?
Walang kulay to.
No,
Pale.
stagnation.
Purple. Sorry, purple, Doc.
Yes. Oh my God, you forgot. It's bawal to forget. Baka akala nila
Oo
kung
nga.
iinom ko, I'll cover muna. This is coffee, ha? Oh, di ba naman?
Oo nga. Sige, Doc.
Ubusin ko eh.
Go.
Kasi medyo malamig. Okay, let's go to, now you know. And what do you think would be false diagnosis? It's going to be choppy or even, di ba, remember?
Yeah,
Oh,
choppy.
yes, you don't forget this. Don't forget this. Heart blood stasis is heart blood stagnation. Yeah. Next, palpating the chest reveals tenderness around the center.
Lung excess condition, Doc.
So there could be phlegm, heat of the lung, or yeah, usually phlegm, heat, yung excess. Okay, number 24, palpating the chest reveals tenderness that is relieved by palpation. Ito pa lang, may idea na tayo, no?
Heart or lung deficiency
Yes,
condition.
relieved by palpation. That's why these people, they love massages. They love acupressure. If they don't want massage, or if okay lang kung ano, they want only light massage, no? That's so if you have it really pays to have a wellness establishment. You can actually really review your basics. Yeah, heart or lung deficiency condition. Okay, number 25. Palpating the chest reveals tenderness relieved by light palpation, but elicited by deeper palpation.
There is a combination of deficiency and excess.
Yeah, this is very common. Okay, thank you so much, Dr. Janine. I hope you had fun.
Thank you. Yes,
Yeah, we'll
Doc.
probably
Thank
call
you.
you again. Okay, Sir Victor, good evening.
Good evening po ulit.
Okay, baka gusto mo lahat-lahat na para si Okay, okay. Anong ibig sabihin ng norm? Like when you do abdominal diagnosis, it's normal. What does it like how at paano ang palpation niya? Paano mo malalaman na normal po siya?
Syempre yung
Hmm.
abdomen should feel solid but not hard.
Oh, yeah.
Resilient but
Resilient.
not too tight. Tapos elastic but not too soft.
Very good. So I hope you start doing that. Tapos na tayo sa chest, punta na tayo ngayon sa abdomen. Diba? Hmm.
Mm.
Okay. What is this? Abdominal diagnosis niya. Hard yung abdomen or may pain aggravated by palpation. Keyword here is aggravated. So what is this? Full or empty?
Full condition.
Very good. I remember, sir. Victor, pumasok na naman. Remember the baha? Hindi ko
Oo.
Anyway, let's talk about it later when there's time. Abdominal diagnosis. Too soft. Buti na lang na ano na natin sa day 1 yung practicum, no? Grabe. What an experience. Pero tuloy pa rin. Okay. Abdominal diagnosis, too soft or ache relieved by palpation. Gustong-gusto niyang ipa-palpate.
Empty condition.
Very good. Now, lower abdomen is soft and flabby. What does it mean?
A deficiency of original chi.
Okay. That's why do not forget to needle your REN 4 or REN 6, especially REN 6. No?
Yes po.
Yeah. So, or if you don't want to do it, you can do it on the ear. Okay. Pero ba, Diyos ko naman, tusok lang, REN 6. Okay. Next, abdominal diagnosis reveals abdominal masses that come and go and move on palpation. Actually, the topic today is very easy, no? Yes.
Oo.
What is this? What pattern?
Stagnation.
Yeah, chi, stagnation. Of course, yung susunod, opposite. Okay. Fixed abdominal masses. So, what is,
Blood stasis.
yes. And what do you expect to see in the tongue?
Dark purple.
Yes. Or dark purple spot. Or the tongue may be purple. But sometimes, hindi purple ang tongue. What do you look for? You look under the tongue, sublingual veins, right? What does
Opo,
the
sublingual.
pulse? Yeah, what does the pulse consist of? Or why do we check the pulse? What does it involve?
It involves the chi, the blood, and essence.
Yeah.
Yin and yang.
Yes, chi, blood, and essence. Because essence, yeah, chi, blood, and essence. Why is the pulse diagnosis very important?
It can give a detailed info on the state of the internal organs and also reflects the whole complex of chi and blood.
Galing. Master mo na ang diagnosis ng pulse, no? What is the history? Can you tell us a little history of the pulse?
Dun sa book ng Suwen,
Mm.
pulse felt at the 9 regions. Ayan, 3 on the head, 3 on the hands, 3 on the legs.
Yeah. So can you imagine? Sabay pa natin yung head and legs. We'll probably discuss that some other time, no? Doon muna tayo sa, hindi pa nga natin na-master yung pulse, punta na tayo kaagad sa, yung sa hands, no? Sa wrist. Next, how many sections to the pulse?
There are 3 sections on the pulse.
What are they?
Chun, Guan, and Chi.
Okay. Sun, Huan, Shi, Shir. Okay. Dapat medyo paipit yung Shi mo. Next. How many levels to the pulse?
3 levels, superficial, middle, saka deep.
Very good. Easy. What is the Tsun position?
Proximal, Ano pala, distal towards the fingers.
Very good. What is the left Sun position?
It's the position of the heart or small intestine.
Good. Right Sun position.
Right is lungs and large intestine.
Very good. What is the Quan position?
Middle lung
Okay.
9 siya.
So this is lung 9. Yun nararamdaman nyo. Kasi of course, you don't feel the pulse on that styloid process. You're actually feeling the pulse at lung 9. Next. Left Quan position. Ano po yun?
Liver and gallbladder.
Very good. The right Quan position.
Spleen and stomach.
Very good. What is the Shi position?
It's kidney
Where is it
yin.
located? Like
Ah.
in terms of the wrist.
It's proximal to the body. So it's the last position or
Okay.
closest.
It's the proximal position. Next. What is the left Shi position?
It's kidney and bladder.
Good. Right Shi position.
It's Mingmen.
Okay. The Mingmen or the kidney yang. Diba? What is Mingmen, Sir Victor?
It's a gate of life.
Okay, the fire of the gate of vitality. Okay, so if you have no more fire, mahina na yung kidney yang mo. Now you understand, no? The other one sa left is kidney yin. Ito naman, kidney and bladder. Kasi kasama ko yung bladder. Ito naman sa ano is the Mingmen. Okay. Fire of the gate of vitality. Next. What is the superficial level? How do you feel? Like, how do you define it?
You just rest your finger to feel the pulse.
Yes, you rest it on the artery. What is the deep level?
You press hard to feel the deeper pulse.
Yeah, you have to feel the bone. Sometimes nawawala na yung pulse. There are people you can only feel their pulse when you press really hard and you have to wait for the pulse to come out. What is the middle level?
Between the superficial and the deep level.
Yeah, yes. What are the methods for taking the pulse?
So, index finger, thumb position, middle finger, guan position, the ring finger in the Shi position.
Okay, and then?
Take the pulse at all 3 positions, then check one by one by pressing superficially first, then slowly
Yes.
being deeper.
All the 3 levels, the last. Very good. What are the 5 movements of pulse diagnosis or the techniques?
The techniques are lifting, pressing, searching, rolling, and pushing.
Okay, what do you use? Pressing.
Your 3 fingers.
Okay, tuloy lang natin, Sir Victor, ha? Kasi para related lahat. Pag nag-iba na yung topic, we'll give that to Dr. Angeli. Baka hindi pa sila nakarating. What is lifting?
It's lifting the fingers to feel the superficial level.
Yes, you're focusing on the superficial. That's lifting. Pressing.
Pressing is giving pressure to the finger to feel the bone at the deep level.
Yes. What is searching?
Searching is maybe counting the rate of the pulse or searching for the beat of the pulse.
Yes. Actually, we're doing the three already, di ba? The lifting, the pressing, and the searching, di ba? We do that.
Yes.
Yeah.
Mm.
Okay. And what is pushing? Ito, not so much. So,
It's moving the fingers side to side from lateral to medial.
parang hinihiwalay mo, lateral to medial. From out in. Okay. Pushing. Next, what is rolling?
Rolling is moving the fingers back and forth from proximal to distal or back.
Okay, from now on, can you do all 5?
Yes po.
Okay, exciting, no? Oh, di ba webinar lang tayo, Maroon? What are the qualities of a normal pulse?
They have stomach chi, spirit, and root.
Ibig sabihin, when you say stomach chi, you can feel it, but it's not very hard, it's not very soft. That's stomach chi. Just like the tongue, diba? The coating should be exact. It should not be too thick, too thin. It shouldn't be too thick, or it should not be absent. Okay? Palpation of the skin. What do we feel for? Ay, yeah. Saan ba ta? I palpate. Yeah.
Tissue of the skin. Yeah.
What do we check?
It's a method to feel the variation of the arterial pulse, and also to touch the skin or the chest or other parts of the body to check for the any symptoms.
Like what?
Like let's say moisture for the
Okay. Good.
if it's oily or
So you check the temperature, the moisture, the texture, presence of pain, and masses. See? What are the 3
tenderness
palpation?
also.
What are the 3 palpation techniques?
Touching, stroking, pressing.
Okay. So the next question would be, what is touching? What do we check when we touch? Excuse me. Light touch lets you know about the skin. Light lang. Light lang. What do we look for?
Can check the, you can feel the temperature if it's hot or cold. Also, yeah. Also, if it's moving or something.
Moving. You check the temperature or moisture. Like we want to determine if there is external invasion or there is interior heat or cold. Okay. So by this time, alam nyo na po ang difference, no? See, external invasion, interior heat or cold, aside from the other symptoms that we have discussed in the past. Stroking, Sir Victor. Through muscles and flesh. So what do we look for here? Of course, when you stroke, you're actually probing for the deeper tissue.
If there is pain or some soreness, some swelling,
Okay.
also the texture of the skin.
And where do we do this usually?
In the chest, abdomen, also the limbs,
Yeah,
maybe
very
shoulder.
good. Searched. So chest, abdomen, and limbs. Okay. Pressing to the sinew and bone. So malalim to. What do we do here?
Locating some areas of pain, depending on the pressure. Let's say pressing into the abdomen, or if you can reach some areas of the organs. Also the determining the empty or full condition.
Very good. locate the areas of the pain with pressure. No, we press into the abdomen. So of course, we're basically checking the organs in the abdomen to determine empty or full. Alam nyo naman difference pag empty sa full. Feel for masses, painful areas. Okay. What are the 5 energetic layers and the associated organs? Starting from the skin.
Uh, from the skin, it's associated with the lungs, for
Then,
the muscle, spleen,
okay.
for the vessels, heart, sinews, the liver, the bones, kidneys.
Okay, very good. Very easy. Now you know. Diba? Palpation.
Hmm.
Okay. Now let's go to body, skin, and chest. If there's superficial heat with touch, what does it mean? Tinatch mo lang,
There's
light touch. Yeah.
sa light touch, may external wind, or there's some heat, cold invasion.
Okay, basta external invasion. Could be heat, wind, or heat or cold. No? Because kahit cold invasion yan, merong heat pa rin. No? It's an attempt to fight off the invader. Next, if the superficial heat subsides after a minute, what is the... So, di ba kanina you said, if there's superficial heat when you touch lightly the body, skin, and the chest, no? There could be external invasion. Could be wind, heat, or
Yes.
cold. Now, nawala ang heat, superficial heat after 1 minute. What is the diagnosis?
It could be empty heat from lung yin deficiency.
Galing. So what do you expect to see in the tongue?
Pag empty heat,
What will be the
teka.
color of the tongue when you have empty heat? And where are you,
Pink,
yeah, I'm sorry?
pinkish,
It's
or
already
light,
empty heat.
like
Empty heat na po
empty.
ito. If it's pinkish, it's still normal.
Pale tongue.
No, no. Okay, when you have lung yin deficiency, what do you expect to see in the tongue? Will you expect a thick coat or no coat? Will you
Siguro
expect that area to be thin or swollen? You know the lung area? Front third, right? Behind the heart. I'm sure you've seen. I think when we did I've seen some tongues that were a little bit deficient. May crack pa nga no? You notice? So it's
Yes po.
basically a payat.
Yes, yeah.
Yeah, it's a bit thin. Kasi yin deficiency yan kulang sa nutrition. Probably they did not follow the advice of, which reminds me, andito pa pala yung app, yung binigay. Thank you, Dr. Janine, for the castor oil. Open ko pala. I put it in front of me. Thank you so much. I'll try that later. Okay. So,
Yan ba yun? Pale coating. Pale.
wait lang. Lung yin deficiency, do you expect to see a coat?
Yung ano.
Yeah, you know that.
Thin coating.
What did you learn about yin deficiency? Do you see a coat?
Yan pala yung kung may coat man, yung parang carpet. Yun ba yun?
Hindi.
Wala
Gusto
na.
mo yung tangko. Yung tangko, Dok.
Wala nang coat, Sir Victor. Wala nang coat.
Wala.
Remember, pag rootless coating yon yung sinasabi mo. Meron pang like we're referring to the stomach to the fish. stomach Qi deficiency, no? Pag wala ng coating, that's yin deficiency. But ito, lang yin deficiency, sa lang tayo nakafocus. Kaya nakikita mo na yung mga cracks. Remember, yung mga inherited conditions, inherited weaknesses ng mga parents, grandparents. Or you have had a very, shall we say, childhood na full of ang daming ginastos ng parents mo sa ospital. Okay, Sir Victor, that means wala ng coating, no? It takes about, sabi ng iba, 10 years for the yin deficiency to turn into heat. So this time, you can have a red tongue. Okay?
Baliktad pala yung ano ko.
Baliktad talaga. So, ibig sabihin, if the superficial heat subsides after a minute, this is chronic. No? Nawala siya. Yin deficient siya. Okay. Okay, you feel the forehead. If it is hot, I'm sure you all do this when your kids have fever.
Yes po.
Okay. So, if it is hot, hot yung forehead, you check the palms. Okay.
Yes.
So, if the palms are hot also, what does it mean?
There is interior heat.
Okay, if the palm kasi is, okay, if it is not hot, kasi di ba interior ang palm, no?
Yes.
Remember? Yeah. Oh,
Pagka,
kasi do you remember yung yin deficiency heat? Yung paggabi, 5 pounds, ano ang tawag dito? Mainit ang palms, mainit ang soles, mainit yung center ng chest, right?
Yes.
Yeah. So, pag mainit yung forehead, chinek mo yung palms, mainit din. So that's interior heat. So that means meron na talagang heat sa loob. Pero pag hindi mainit yung palms, then that's exterior. Kasi the exterior is dito. Clear?
Yes.
Yeah. Andiyan na kaya si Doktora? I will probably call her siguro mga 70 na. O sige, tuloy natin para hindi mawala yung momentum. Hit at the muscle or vessel layer with stroking pressure. What does it mean?
Interior heat of the heart or spleen.
Okay. Hit at the level of sinews and bones when pressing. What does it mean? Malalim na to, ha?
Empty heat from liver or kidney yin deficiency.
Okay, what is the color of the tongue here now? Still pale?
Mainit. So, liver area, kidney yin.
Empty heat na, oh. Empty heat. Because of the liver or kidney yin deficiency, nag-evolve na siya because hindi nagpatingin ng acupuncturist. So what happens now?
Mapula rin yung ano.
Mapula na. Mapula na. And liver and kidney, they go together. Next. Oh, maybe we can call. Thank you so much, Sir Victor. Can we call on Doctora? Very good job po, Sir Victor. Thank you so much.
Thank you po, Doc.
Yeah, let's call on Dr. Angeli Templo. Are you home already?
Yeah. Yes, Doc. Dito na po.
Sige po, sige. Kasi parang ngayon ko lang kayo nakita ulit, but I'm not complaining. Okay. So
Sorry
now,
po, sobrang busy.
alam ko, I understand. Even though our time is so, but we still find time to really meet. Okay. How do you describe the moisture of a normal skin?
There's sufficient or abundance of qi and blood.
Like if okay, let's say this is your how do you determine it? What is the first thing that you will, diba pag ganon? When do you say na elastic yung skin? Kung bumabalik pa or hindi na?
Bumabalik pa po.
Yeah, mabilis. Normal skin should be
Yes.
moist and elastic. It should never be dry. Is it moist?
Yeah.
Now, if it's too moist, what is the pattern?
Young deficiency or full or empty heat.
Yes, causing sweat. So it's both, yeah.
Young deficient.
Kasi pag meron kang sweat, of course, ano yon, it could result from full heat or empty heat. Too moist, no? So dalawa yung ating patterns. Could be young. Of course, pag young deficiency, the patient feels cold. Okay. Diba? You've seen, probably naglalamano kayo, you probably felt na some of their are so basa, no? Young
Basa,
deficient. Tapos
moist.
malamig. Okay. Moist
Yung
and
matatanda, Doc.
Oo, grabe naman. Okay, sige. Yeah, moist and greasy. What is the diagnosis?
There's dampness.
Yeah, or phlegm. Yeah. Moist and greasy. Remember, greasy tongue coating, no? Tingnan mo yung tongue. And then, I'm sure, favorite niya, just like my patient this morning, loves donuts. Oh my God. Ano pa, pasta. Yeah, so yun. That was my anxiety. Okay. Next, dry skin po. What is the diagnosis?
Blood iron deficiency or blood stasis.
Yes. Of course, pag may blood stasis, hindi maganda yung flow ng blood, no? Tuyo talaga. Rough and scaly skin. What is the diagnosis?
Blood deficiency or stasis.
Or, yeah, P syndrome. You know what
Why?
P syndrome
P.
is? PI. That's painful obstruction syndrome, often due to cold, wind, or heat. No? So, painful obstruction syndrome. We will be dealing with that when we deal with patterns. Okay? Yeah. What texture is dry? Dry yung skin. What is the diagnosis?
Blood deficiency.
Very good. Rough and very dry and scaly.
Blood deficiency, blood dryness, and spleen deficiency.
Good. Swelling ng, okay, the thumb pressure leaves a mark. You know what is this? Nagsuswell. Sabihin na natin yung ankle. Yung ankle niya, usually doon yung swelling. Okay, you applied thumb pressure. What does this mean? Nagkaroon ng mark. Ayaw umano. What is this?
There's cheese stagnation in the area. There's excess of water.
Mm-hmm. If it is young deficiency, water swelling, it leaves a mark, no? So edema pressure does not leave a mark. That's cheese stagnation or blood loss or blood stasis. So young deficiency, water swelling, it leaves a mark.
Iron deficiency.
The thumb does not leave a mark.
Yes. Cheese stagnations or blood stasis.
Okay, so now you know. Then you can confirm it also by looking at the tongue, di ba? Particularly blood stasis. Feel the pulse, di ba, doktora? So what do you expect to, if it's cheese stagnation, ano yung pulse characteristic? Will it be wiry? Will it be slippery? Or will it be will it be choppy? Cheese stagnation. It's usually wiry, no?
Wiry.
Blood stasis, usually choppy. Or even thready, pag grabe yung deficiency. Okay, pain is better with pressure. What is this po? Empty or full?
Empty.
Very good. Pain is worse with pressure. What is this?
Full.
Yes. Chest palpation. What do we do the chest palpation for? What are we trying to check here?
Chest palpation for heart, lungs, and breast tissues.
and pericardium.
NPC.
Heart, lungs, pericardium. So if the apical pulse, okay, what do we check the apical pulse for? At the fifth intercostal space, left mid-clavicular line. Okay. What are we checking? I
This is
think
the
it was,
gathering,
yeah.
the state of the PC, heart and lungs.
Okay, the gathering chi of the chest, the heart and lungs. This was asked earlier. Okay, let's now go to the temperature. Detect the temperature of the abdomen in different areas. Okay, if ano to? If it is cold, ano po yon?
It's full cold or yang deficiency.
If it is hot,
It's full or empty.
heat. Okay.
External heat.
The radial pulse indicates heat, dapat so mabilis. But when you check the abdomen, it is not hot. So what is it? What is it? Is it
Food retention po.
No. The radial pulse mayroong heat, pero yung
Ay,
abdomen
radial.
hindi hot.
Abdomen is hot.
Yeah. No, hindi hot ang abdomen, pero yung pulse niya
Abdomen is not hot.
mabilis. Yes. What is it? External heat or internal heat?
External heat po.
External heat. Make sense? Yes. Okay, for kids, pag merong hot ang abdomen ng kids, what does it mean? There is
Food retention.
food retention, kaya umiiyak.
Food retention.
Cold, if there is cold around the umbilicus, what is this?
This is gate of life, fire deficiency.
Okay, so check mo yung Mingmen fire niya, mahina, kidney yang, no? So again, if it is cold, it is full cold or yang deficiency. Hot, full or empty heat. But if the radial pulse indicates heat, but the abdomen is not hot, it's external heat. For kids, hot abdomen means food retention. Cold, okay, you palpate the abdominal area around the umbilicus. There is deficiency of the gate of life fire. Okay, when you check the Mingmen, where is the Mingmen? Sa right, no? Right, sure, diba? So, ano siya? Deficient. Now, let's go to texture and masses. What's the normal texture, Doctora?
It's soft, superficially firmer with deeper pressure.
Okay, good.
Palpation.
If very soft or flaccid epigastrium, what does it mean? We're still on the abdomen, huh? Palpate.
Spleen. Yeah. It's spleen and stomach deficiency.
Very good. If the very soft or flaccid lower abdomen, very soft lower abdomen.
Very soft.
Yeah. Andun na sa yuan chi.
Spleen.
Yeah.
Yuan chi. It's spleen and kidney deficiency.
Very good. Okay, if it is hard and full, what does it signify?
There's chi stagnation, blood stasis, dump, food retention.
Yes, very good. Chi stagnation with distension, blood stasis with pain, dampness or food retention with fullness. Okay, abdominal tenderness naman tayo. If light palpation causes pain, what is the diagnosis?
There's a full condition where there's chi stagnation.
Yeah, full condition would mean chi stagnation, blood stasis, dampness, food retention, saka heat or cold, no? Pressure relieves pain. What is this? Sorry.
It's a deficiency condition.
Okay, if it is the epigastrium, and the pressure, when you apply pressure sa epigastrium, it relieves the pain. So what organs are deficient?
The spleen and the stomach.
So kung nasa central lower part, and then there is when you apply pressure, gustong-gusto nila na relieve ang pain. So what organs are deficient?
The spleen and the kidneys.
And the liver. Spleen,
And the
kidney, liver. Central lower. Tender with deep pressing.
There's blood stasis.
Okay. Relieve with lighter pressing, worse with deeper pressing.
Here po, it's mixed excess deficiency.
Okay. Like liver chi
Like
stagnation.
liver
and
chi
spleen.
stagnation
Okay,
and
you may have
spleen chi
noticed, I'm sure you have noticed this by now. If the liver chi is like, siba sa left yung liver, if it is excess, sa kabila, it is deficient. No? Na-notice nyo? Diba? Nasa second pulse yung, diba? Sa Quan pulse, sa left is liver. If it is matapang or excess, mahina po yung spleen. Okay? So you need to be able to be, but I tell you, it usually it starts as liver chi stagnation most of the time. Kaya if you treat all patients, remember when we did the liver chi stagnation, everybody loved it. Ay, when was that? No, yung isa palang class, yung pulse after the baha. Okay. Number 90, let's go to abdominal palpation. The difference between distension and fullness po, Doctora. Can you describe it?
distension, it's hard like a drum but elastic. With fullness, hardness but no feeling of distension. There's
Okay.
hardness but no feeling
Yeah,
of
have you
distension.
seen doctors doing like this, yung tapping? Parang drum yung feeling. You also try to do that. Maraming ganun sa YouTube. Okay? It would be very good to see all practitioners doing that. Pero syempre, ano lang naman to for academic purposes. But, well, just to confirm, parang add-on natin, no? Next, tenderness with palpation causes pain. What does it mean?
There's an excess syndrome.
Like chi, blood, stasis, damp, retention, food retention, heat, and cold. These are all excess. Light palpation provides relief of pain.
It's a deficiency syndrome.
Okay. Check the temperature and moisture always when palpating the abdomen. Okay, you know where the xiphoid process is, no? Okay, that involves the stomach, the heart, and the chong. Chong is penetrating vessel. It's an extraordinary vessel, no? So we're also going to discuss it in detail. Okay, so what does it mean pag hard yung area under the xiphoid?
There's stagnant chi or blood of heart.
So that means the cause is emotional. See?
Yes.
Emotional cause. Sige nga, try. Yung mga pasyente nyo na medyo when you feel, you know the xiphoid, no? The tip of the sternum,
Yes po.
pababa. Okay. If you feel na parang, kasi diba, like, masakit yan dyan. Ibig sabihin, the cause is emotional. So, of course, heart chi or heart blood stagnation. That's why, ang dami-daming may heart, you know, a lot of people would succumb to heart issues. They just don't know it. So we have to learn how to deal with emotions. Next, if that area is soft, what does it mean po? Soft and painful.
There's stomach heat with underlying chi deficiency.
Very good. Now let's go to the epigastrium, which is between the xiphoid and the umbilicus. that represents your stomach and spleen. So imagine natin yan ha, the area between the xiphoid process and the umbilicus. So the stomach and spleen. How, pag hard po siya, what does it mean?
It's an exist condition of stomach
So
where
it could
there's
be
chi or blood stagnation.
dampness, food retention. Okay? Okay, if it is distended like a drum,
Chi stagnation.
yes. So the key word is distension, chi stagnation.
This-
Subjective fullness. So that means the patient feels full, pero when you palpate that area, it is soft. What does this represent?
Mixed deficiency and
An
excess.
excess. Very good. Dampness and okay. Palpation relieves discomfort.
Deficiency of stomach.
Yes, very good. So again, yung kanina, subjective fullness but softened palpation, mixed deficiency or excess, stomach heat, and spleen chi deficiency. Remember, stomach heat is excess, spleen chi deficiency is deficient. Now, let's go to the hypochondrium. This represents the liver and gallbladder. If it is standard with palpation, what does it mean?
It's liver chi stagnation, liver blood stagnation, damp heat in the liver and gallbladder.
If it is relieved by palpation,
It's liver blood
okay.
deficiency.
Siguro we'll go up to 100, Doctora, then we go back to Doc Janine, no? Mukhang para ano, para matapos tayo lahat. Okay. Hypochondrium, like tender with palpation, what does it mean?
Yun na po to. Liver chi stagnation, yung
Ay, okay. Tapos na po.
liver blood, yeah.
Yeah, we go to
97.
umbilicus. Kidneys and chong and ren. Ren is the channel in the midline, sa anterior. Chong is the penetrating vessel, which is very, very important when it comes to diagnosing gynecological diseases in TCM. Okay, hard and full, Doctora, the umbilicus. What does it mean?
It's chi and blood stagnation in the chong.
Yes. If there is pain,
Blood stasis in the chong.
very soft.
Kidney deficiency and chong and ren.
Yes, very good. 98, lateral lower abdomen or shao fu, the intestines and the chong. If it is hard,
Dump in the intestines or stasis in chong.
okay. If it is painful,
Chong blood stasis.
if there is a mass,
Blood stasis in intestines and chong.
okay. If you notice, pag may mass na, that's blood stasis. Okay. Next, central lower, shao fu, small intestine, kidney, bladder, uterus, liver, or the ren. If it is hard, what does it mean?
Dump in the small intestines or bladder.
There is pain,
Chi stagnation or blood stagnation in the small intestines or bladder.
in women, it means
Blood stagnation
Okay.
in the uterus.
so there is probably fibroids or myoma. And we hope that it's not malignant. Usually, hindi naman siya malignant. Next. Okay. Thank you, Doctora. I know medyo napagod kayo. Baka thank you so much. We hope to see you again
Thanks,
next
Doc.
time. Thank you po. Let's
Yes,
go back
Doc.
to Dr.
Yes.
Janine.
Yes, Doc.
Okay, if you have a patient who comes in with cold hands and feet, what is your initial diagnosis?
Spleen or stomach yang deficiency.
Okay. Cold hands lang.
Long or heart yang deficiency.
Okay, so you know what to do next time. If it includes the feet, the stomach and spleen, no? Okay,
Stomach na
cold
yun.
feet lang.
Cold feet lang, kidney yang deficiency.
Very good. Cold hands and feet in women.
Blood deficiency.
And they probably have amenorrhea, no? Hindi na may mens or masyadong scanty ang menses. Hot dorsum, you know, the dorsum here of the hands and feet. And then ano naman ibig sabihin pag hot palms or soles?
Pag sa hands and feet, it means full heat. Pag
Yeah.
sa palms and soles, empty heat.
Very good. So full heat. Okay. Cold hands in women.
Heart blood deficiency.
And usually they are forgetful. Ang hirap nila makatulog. Cold feet in women.
Liver blood deficiency.
Cold fingers and toes.
Liver qi stagnation.
Great. Cold hands and feet.
Phlegm or interior heat obstructing circulation of qi.
Very good. Okay, let's now go to the front collecting the moo points, the front, no? This will detect excess or deficiency of the associated organs. So what happens if you use the probe, tapos tender siya or sharp? What does it mean?
There's a full pattern.
If it is better with pressure or there is just dull soreness?
It is an empty pattern.
Very good. Back shoe na naman tayo. Same as front moo. Tender or sharp pain?
Still full pattern.
Yeah. Dull soreness or better with pressure?
Empty pattern.
Kaya don't be surprised if they tell you there's no pain kasi they like it. No? Yeah, they like it. Apply more pressure. So that means deficient.
Oo.
But if they say, hindi masakit, excess ka agad yun. No?
Mas maraming empty doc.
Yes. Yeah, kasi deficiency usually ang chronic, no? Now you know.
Yeah.
Now let's go to Yuan
Yes.
source points. Heme organs or
Yes.
channels. So what do we note here? What do we look for here?
The changes in the skin over the source points and the report of its tenderness.
Yeah. For example, kidney 3. Tingnan niyo po yung kidney 3. Like, may iba yung kulay ng skin.
Yellowish. Ganyan.
Yes. Yeah. Basta there's a discoloration there on that area. You will immediately know.
Yeah.
Next, luo connecting channels. This is your topic for, for 2 modules from now. Luo connecting channels.
They are more superficial than the main channels and
Yeah.
run sideways. Tama?
Okay.
Ganun ba,
We
Doc?
usually use the luo connecting channels for emotional issues, psycho-emotional. But you'll get to lower these things. Muscle channels or the sinew.
For psycho-emotional. Sandali lang, Doc. Emotional channels. Okay.
You will know that.
Muscle. Palpate these to determine any locations of pain on
Very
which
easy,
channel.
diba? Yeah. P syndrome.
Palpate the painful area and check the
Yes.
temperature and texture.
And then?
And then palpate distal points on affected channel and find ashy points.
Yes.
Reactivate ashy points. Reactivate ashy points if they are local stagnation and choose the treatment.
Yeah, reactive ashy points are local stagnation. Ito yung like
they
if they
react.
tell you this is painful doon. No? Yun yung ashy. Okay. That's why
Okay.
yung mga points, we start from distal, then the cause, then ano. Now, the Hussey points or the low C points. At this point in time, it is important that you should know all these things.
So low C, Doc, is Hussey points.
Yeah, Hussey,
Okay.
yes.
Okay.
So, like stomach
Okay,
36.
The stomach.
Yeah.
Yeah, that one.
So, we classify stomach 36 as the Hussey point of the stomach. No? Sige.
Okay.
Basahin na lang natin.
LI.
Stomach
Stomach
37 naman
37.
for for LI. Ang stomach 39 for SI. So nauna yung LI sa SI. Then bladder 43 for the lungs. Bladder 52, low C point for the kidney. Then the sacrum points, we have bladder 31, 32, 33, 34. Okay, there are four. Bladder 31, 32, 33, 34. Anyway, this is for the reproductive system. Kaya if you are thinking of making your patient with fertility issue improve,
These
then
are
you
the
might want to try these points. But this is another story. Next, we have the so-called Langway Shui. Like if you have a patient with, okay, continue po.
The Danang Shui is the gallbladder issue.
Yes. If you have a patient, Langway Shui is for the appendix. No? So of course, you still have to bring the patient to the hospital. Kasi pag nakita mo, yun, masakit yun. Danang Shui for the gallbladder. Ashi point, sharp pain, that's full pattern. Dahil sa kabisado niya na po ito.
Empty pattern.
Yeah.
Oh, Lanshui ang
Yeah.
appendix.
So tamang-tama, my estimate is we will finish by this time. And I'd like to thank all of you for joining. Unless you have questions. Hello po. Sige lang, kahit konti lang po kayo, I'm sure nakikinig naman sila. Okay, any
Kailangan naman talaga yung mga ano lang nila.
Yeah.
Nakakalito
Ulit-ulit lang yan.
Yeah.
Ulit-ulit lang. If I'm not mistaken, next week will be, is it the pulse or the tongue? Okay. So,
okay, Doc, question. On the low C points, the C points, di ba? Like, how do you say, what is horary? Yan, mga Hasi, what are the difference of the, di ba?
Okay.
Why? Like
No,
strength?
horary is different from the Hasi. Hasi is part of the five shu, but this one, aside from the Hos, di ba, meron tayong tinatawag na low C. But that's another story. Let me talk about the horary. When you say horary points, for example, if it is the heart channel, the heart channel also has its elements. No, the heart channel has its own wood element, fire element, earth element, metal, and water element. So the fire element of the heart channel is the horary point. That is right. Yes, like parang overkill. No? So, basta, di ba, all the channels have 5 elements. So, example, the metal element, the lung channel. The lung channel is a metal element. So, the horary point is the metal point of the lung channel. Understand?
Okay. So its element is its horary. Yes. Okay, got it.
Yeah, its own element. So it's like an overkill.
Okay.
So when we get to study the 5 shu points, you will understand why those points, yung 4 points, the Korean 4-point needle technique, are so effective. No?
That's why.
So effective. And it requires a very good diagnosis for you to be able to hit the jackpot. Diba? But you can never go wrong, especially if you notice na medyo stressful yung pasyente. Okay.
Pero Doc, how will you know, like, you gave us a chart. One is to tonify and the other one is to sedate, right? And then you look for the horary point. So if you're tonifying, you look for the strength in that organ, diba?
Yeah.
What about when you sedate? What do you look in the horary point? Same pa rin?
Okay. First, when you sedate, you're actually sedating an excess chi, no? So parang it's like this. An organ becomes deficient when the controlling element is so overpowering.
Yes.
Okay, for example, you have the heart controlling the heart, controlling the lung, right? And then the water controlling the fire. So if the controller is so strong, hihina naman yung kinokontrol niya.
Yeah.
So
Yeah.
we try to sedate. If you notice, we don't only tonify, we also sedate. You get it?
Yes. Yes.
Example, if the organ is deficient, why is it deficient? Okay, first you tonify the mother. We not only tonify the mother, but we also tonify the horary point, no? The element of the mother. Ano, the point.
So the
of the-
so Doc said the sedation point you're doing on one ear is because you're sedating actually the horary point. Tama ba?
No. Example, it depends. Like if, because punta muna tayo sa deficient, no? Mahina ang organ. Okay? The lung organ, for example. Of course, if it is weak, we would like to tonify the mother. Right?
Yes.
Who is the mother of the lung? The mother of the lung is, no, the mother. Talking about the mother. It should be the earth organ, the spleen. So we not only tonify the spleen, but we also tonify the horary point of the earth. So
Which is the
ibig sabihin, we also tonify, I'm sorry, the earth point of the spleen. So ibig sabihin, spleen na siya, earth na siya, meron pa, kasi may kanya-kanya din tayong points, no? Now, who is controlling the lung? Diba? It's the heart, right?
Yes.
If the heart is too much, it will weaken the lung. It controls the lung. Diba? If there's too much fire, it will melt the metal. So what do? We sedate the fire, the heart. And then we also sedate the horary point. Ganun siya. Diba?
The horary point of the heart.
Parang overkill. So we tonify the mother, we sedate the controller. Okay? Kasi we want the organ that is involved to be strong. Kasi can you imagine if you do not do something about the controller, lalong hihina. Diba? Like for example, the water element, it controls the fire. We want to weaken kailangan bawasan mo.
Ng tubig.
Kasi hindi naiinit si fire. Interesting.
Okay.
Now you understand why there are 4 points. 4-point needle technique. And you can never go wrong when you start with liver chi stagnation. But sabi nga ni Machocha, when you talk about chi stagnation, it not only involves the liver, it also involves other organs. Anyway, so much for that. I hope, so it's good that kahit konti lang kayo, the questions that you ask are very good.
We want to do the correct points, Doc. Diba?
Of course.
Yeah, you see, although you see the difference in my patient who's the autistic one, her
The one with the
tongue, yes, her tongue isn't as pale anymore.
That's good. Congratulations. You've probably been seeing the patient for like a week already? 2 weeks?
Ano na, Doc, parang naka-4 na ba? 4 times na yata.
Congratulations. You could really see. And I'm sure the coating has improved, right?
Not yet so much, Doc. The mom prefers me to tone down her agitation din kasi.
Yeah. The mere fact that, okay, yes.
So she like,
the patient is enjoying the protocol, no?
Yeah, the first two, although like yesterday, parang natakot ulit siya, but may may new factor kasi the father came up.
Okay.
So sabi ko baka yun lang na
Yeah, yun.
feeling
Grabe talaga ang
baby,
impact ng
baby.
emotions. So this time you feel her chest or the xiphoid process below. Okay,
I'll do that. Okay, Doc.
interesting. We thank you so much. Now you understand why we would like to start early. But I know you haven't had dinner yet and you have so many things to do. And thank you, Dr. Anjali, na talagang
Thank you, Doc.
in spite of that, pinipilit pa rin niya mag-attend. And of course, the ever reliable Sir Victor na mukhang hindi yata nag-absent, buti naman. And
Oo
then,
nga.
yes, and the answers are are amazing. So also Ma'am Leia, who is in Kidapawan. Hello po. And tayo lang pala. Okay, but anyway, thank you so much and we hope to see you again next week. So we meet on Monday. Yeah, Monday. And I'm sure you're ready.
Monday pa rin tayo, Doc.
Or gusto nyo ng Tuesday?
Batch 3, akala ko.
Hindi po kasi
Okay lang, Doc.
pumapasok si Ba. Said, okay, ganito na lang. We'll meet either Monday or Tuesday. But for now,
Sige, Doc.
let's meet siguro Monday. Pwede rin
Doc,
Tuesday.
pwede
Gawin na lang natin every Tuesday. Would that be okay? Okay ba yun sa inyo, Doktora?
Yes po, Doc.
Oo,
Yes
kasi
po,
Yes,
Doc.
Doc.
Okay
ang
lang,
gusto
Doc.
kong batch
Okay
3
lang po.
magma-Monday na.
Opo. Doc, pwede mag-sit-in sa batch 3, no? Para ma-refresher
Of
kami.
course, no problem. No charge at all. Pwede kayong mag-sit-in anytime. Maraming salamat po.
Parang review na.
Oo nga, para review na, di ba? Gusto ni
Actually,
Sir Abet mag-exam na daw.
oo. Nako ha, it's a challenge. They all 6 got perfect. Alam niyo ba yun? Sige, ano kayo, try niyong makipag, I got, can you just imagine ang tuwa ko, no? How I wish all of them would have got the perfect score. 80 was the lowest.
Yeah, that's high pa rin, Doc.
Hi. So that means the system works. And even if we're just doing this, kasi ayoko ng very traditional. Like, I don't think everybody listens to a webinar. I don't think so. So dito kasi, you stimulate the student to actually come up with a good answer. So I don't think it's a mortal sin to already give the questions before. Ngayon nga, meron na nga kayong dalawa na bago pa, di ba? And if I were you, ituloy-tuloy nyo na because probably within the week or maybe next week, we will be posting the, week 10. And I'm very proud of all of you. You've done well as usual. We still carry the brand. So thank you so much for putting your trust in us, and we hope to be able to give you the best training ever. And ang ano lang naman yan, and I've seen like how fast you can all learn. I still believe kasi yung foundations is very, very important, no? So, yun. So thank you so much, everyone. Actually, sa ano nga, no? I was telling Abet, like, because of the baha and all, i-experiment natin, no? Like, I was thinking for the lecture on ear diagnosis, we'll do the webinar first. We'll make it very interactive. Diyos ko naman, yung tongue and pulse, para namang ano nyo lang yan eh. Napakadali na lang. Ang ano na lang dyan is the actual, no? Maning-mani na yan. I plan to include other things pa like the nails, everything. Kompleto na. So maraming salamat, Doktora, Sir
Thank
Victor,
you, Doc.
Doc Janine, and of course, si Ma'am Leia. Thank you po. See you all
Maraming salamat po.
next Tuesday. We'll be Tuesdays na ha, kasi para batch 1 will
Yes,
be.
Doc.
Thank you po. Good
Thank
night.
you.
Thanks,
Thank you,
Doc.
Doc. Bye, guys.
Bye-bye, everyone.
Bye.